Comparing it to a bullet train, the governor of New York, Andrew Cuomo, now says the number of confirmed cases in that state is doubling every 3 days. He says the peak may come in about 2 to 3 weeks. But today in Washington, President Trump says that he wants to, quote, reopen the country by Easter. That's despite warnings from health experts. And now to tonight's Max Minute. CBS 2's Dr. Max Gomez tells us about a coronavirus number that you probably haven't heard of. It could be the key to treating the sickest patients and may even help get us back to normal.
If there is one thing that has characterized this coronavirus pandemic, it's numbers. A few good, many scary, and almost all confusing. There's the number of tests, cases, deaths, hospital and ICU beds, ventilators needed, and much, much more. But there is a number that we haven't heard much about that could be a key to beginning to get our world back to normal. That's the number of people who've recovered from COVID-19 infection. The Johns Hopkins site tracks total cases and total number of recovered patients, about 25% of confirmed cases. But there's no good way to know how many people got infected and recovered without ever being hospitalized or even tested. Most estimates are that about 80% of those infected recover. Now, all those millions who have and will recover will have made antibodies against corona, antibodies that will almost certainly protect them against reinfection for what may be a significant period of time. Governor Cuomo has said that those people will have those protective antibodies extracted from their blood, a fairly minor procedure similar to donating blood. Those antibodies will then be given to very sick COVID-19 patients to see if they might be an effective treatment. It's a technique that's been used for years against numerous infections, including chickenpox, measles, rubella, and even used to save people who've been bitten by poisonous snakes. We don't know if it'll work against corona until it's been tested, but it's a much-needed glimmer of hope.
And if you have a question for Dr. Max, please submit it at our Facebook page at CBS New York.